So Lee, you're here today 7 weeks after your tarsal tunnel surgery that I did. So your surgery was what, March 11th?
Yes, March 11th.
So how much pain do you have comparison to how it was 7 weeks ago?
The difference between night and day, it's wonderful compared to what it was.
And you came to me in severe pain, right?
Yes.
And from what I remember, you were pretty frustrated because it's not like you ignored the pain or lived with the pain. You actually went to several specialists before. Well, tell a story.
I went to the first podiatrist, and then he sent me to a nerve guy, and they did a bunch of tests, and I guess he said I needed the surgery, but when they sent me back to the podiatrist, and he didn't want to do surgery, so he just kept giving me shots once in a while, cortisone, but it'd only last a day, and then the pain would be right back. So finally I realized I was going to have to get out of that system and go to somebody else. So thankfully a friend that I worked with had been to see you, and he recommended you, so I came by recommendation, and I'd recommend to anybody to come to you.
Thank you. Well, I mean, it was kind of a remarkable story, but believe it or not, it's not uncommon. And I think that's the limitation of maybe in a way our healthcare, to where if somebody doesn't do this surgery or doesn't feel comfortable doing this surgery, instead of really doing a proper referral, they kind of keep you, like you said, I'm going to quote you, in the circle. And, sometimes you just have to get out of that system. And unfortunately, you're not the first and not the second one, but the most important thing is that you're 7 weeks out and you're so much better, and your pain is gone and the nerve is not compressed, and you're able to live your life instead of being in chronic pain, right?
Every step was miserable.
Yeah, miserable, right? And I can tell you is, the moment I saw you, it was a classic presentation of a tarsal tunnel. And, I'm happy that the neurologist, sort of diagnosed it, because a lot of the times, believe it or not, those tests are negative and people can still have it. None of the tests are 100% diagnostic. But would you recommend tarsal tunnel surgery to people who have tarsal tunnel?
Absolutely.
Did it work for you?
Yes.
So it was worth going through anesthesia?
Oh yeah, it's not even healed yet, and I can still walk better than I could before.
Exactly. Well, thank you so much for sharing your story. I hope it will help other people to make that decision. It's a difficult one. Nobody wants to have surgery, of course, but there is a light at the end of the tunnel.
I say fix it.
Fix it,
I mean,
exactly.
it was broken, fix it.
Exactly. Well, thank you so much.